Hello everyone, now let us discuss about brief summary of anti-migraine drugs. Coming to the first drug, it is sumatriptan. The mode of action is it is 5-HT1B/1D/1F receptor agonist. It constricts large arteries, inhibits trigeminal nerve transmission. The side effects are coronary vasoconstriction and dysrhythmias. Pharmacokinetic aspects are it has poor oral absorption, hence it has delayed response. It can be given subcutaneously and does not cross the blood-brain barrier. Plasma half-life is 1.5 hours. And it is effective in 70% of migraine effects. The short duration of action is the major drawback of this particular drug, and it is contraindicated in coronary disease. Because it causes vasoconstriction, it is contraindicated in coronary disease. And next drugs are almotriptan, elytriptan, frovatriptan, nartriptan, rizatriptan and zolmitriptan. All these drugs, they are also used for acute treatment of migraine. Even sumatriptan is used for acute treatment of migraine. Coming to the mode of action of almotriptan, elytriptan and other drugs, it is 5-HT receptor agonist. They also constrict large arteries, inhibit trigeminal nerve transmission. Additionally, they have actions on CNS. These drugs, they have additional action on CNS. Side effects are less than sumatriptan. Coming to pharmacokinetic aspects, they have improved bioavailability and duration of action. They are able to cross blood-brain barrier. And similar to sumatriptan, but improved pharmacokinetic and reduced cardiac side effects. These drugs are similar to sumatriptan, but they have reduced cardiac effects and improved pharmacokinetics. Next is ergotamine. It is an alkaloid, ergot alkaloid. It is also used for acute use. Coming to the mode of action, it is 5-HT1 receptor partial agonist. Ergotamine is 5-HT1 receptor partial agonist. Also affects alpha adrenoreceptor by causing vasoconstriction. It blocks trigeminal nerve transmission. Side effects are peripheral vasoconstriction, includes coronary vessels, nausea and vomiting, contracts uterine and may also damage the fetus. Coming to pharmacokinetic aspects, it is poorly absorbed and can be given by suppository, inhalation, etc. Duration of action is 12 to 24 hours. It is effective but use is limited due to its side effects. The next drug is methylsergate. It is used for prophylaxis, for the prevention of attacks. Methylsergate is 5-HT2 receptor antagonist or partial agonist. Side effects are nausea and vomiting, diarrhea, retroperitoneal or mediastinal fibrosis. These two are rare, but they are serious. Pharmacokinetic aspects are it is used orally and it is effective but rarely used because of the side effects and insidious toxicity. The next drug which is used for prophylaxis of migraine is pizotifen. It is 5-HT2 and histamine receptor antagonist. Side effects are weight gain, antimuscarinic side effects. It is used orally. Pharmacokinetic aspects are it has good bioavailability when given orally. Next is topiramate. This is also used for prophylaxis. It acts on ion channels, example sodium, and possibly the GABA-A receptor. Side effects are sedation, dizziness, weight loss, nausea, paresthesia and diarrhea. The next, this is also used orally. And this drug, topiramate, is used for treating chronic migraine. Topiramate is used for treating chronic migraine. The next drug is propranolol and similar drugs, that is nothing but beta blockers. So mode of action is beta adrenoreceptor antagonist. Mechanism of anti-migraine effect is not clear. Side effects are fatigue and bronchoconstriction. Propranolol is also used orally. It is effective and widely used for migraine. Other epileptics may also be of value. The next is botulinum toxin A. It probably acts by preventing the neuronal release of CGRP and other neuropeptides. Side effects of botulinum toxin A are muscle paralysis and other neuromuscular disorders if used incorrectly. It is administered via subcutaneously, intramuscular or intradural injection. And a single treatment can act up to 1 year. A single treatment of botulinum A can act up to 1 year. Now coming to ergot alkaloids, let us discuss briefly about ergot alkaloids, which are also used to treat. The first drug in ergot alkaloids is ergotamine. It is usually acts as antagonist at 5-HT receptors. It may act as partial agonist at 5-HT1 receptor and usually antagonist at other sites. When it comes to alpha adrenoreceptors, it acts as partial agonist, especially on the blood vessels. And it does not have any effect on dopamine receptors. When it comes to uterine, it contracts uterine. And main uses are it is used to treat migraine and largely now it is obsolete. Side effects are emesis, vasospasm, and ergotamine should be avoided in peripheral vascular disease and pregnancy. The next drug is dihydroergotamine. This also acts as antagonist at 5-HT receptors. It acts as partial agonist at 5-HT1. And it is an antagonist of alpha receptor. Dopamine receptors have no effect. They are not affected by dihydroergotamine. When it comes to uterus, dihydroergotamine also contracts uterus but to a lesser extent. And the main use is migraine. This also it is largely obsolete. Side effects are less emesis than with ergotamine. The next drug is ergometrine. It is a weak antagonist and partial agonist at 5-HT receptors. When it comes to alpha adrenoreceptor, it is weak antagonist and partial agonist. It has weak effect on dopamine receptors. When it comes to bromocriptine, it has inactive action on 5-HT receptors and it is a weak alpha adrenoreceptor antagonist. It is dopamine agonist or partial agonist. And it is used in Parkinson's disease and endocrine disorders. Side effects are drowsiness and emesis. The next drug is methylsergate. It is 5-HT2A antagonist. Methylsergate is 5-HT2A antagonist and partial agonist at several subtypes. It has no effect on alpha receptor and dopamine receptors. It does not have any effect on uterus also. And it is mainly used to treat carcinoid syndrome, migraine prophylaxis, and this is rarely used. Side effects are retroperitoneal and mediastinal fibrosis and emesis. Thank you for watching. Please subscribe for further videos on pharmacology and pharmaceutical sciences.